What is the back pain? Back pain can happen gradually over time or can be sudden according to its cause. It's a sharp pain that makes you not able to move, especially after a long time of sitting or long time of sleeping. You will experience very painful situation that you can't move, you can't stand up easily, unless if you wait for 1 hour or some time until the inflammation be less, then you can move. But actually, if you have back pain and you're sitting for a long time or sleeping for a long time, you will have a pain during standing up, and it will not be easy to stand up or to move from your position. Risk factors. There are many risk factors that can lead to back pain or to increase your back problem, like your age, if you're old or young. Of course, if you are young, your muscles are more flexible, you are fit, so you'll not get a back pain. If you are old, you'll have more chance to get a back pain. Your fitness, your weight, if your weight is increasing, if you have obesity, of course you will experience back pain. If you are thin, you'll never get a back pain. Your genes, your job activities. Some jobs requires you to carry heavy objects or to lean forward or to do any hard activities. That's why you can get a back problem or a back pain. And some jobs you require you to sit on the office, so you'll not get a back pain. It's according to your job activities. And also smoking. These are the risk factors of back pain. Causes of back pain. There are many causes of back pain, like the muscle spasm or muscle tightness, disc degeneration, scoliosis, pregnancy. So many causes of the back pain, and many other causes. So the right thing to do is to find out the cause of your back pain to get a proper treatment. What does it mean? It means we don't want a symptomatic treatment. I don't want to relieve your pain only. No, we want to treat the cause, to make your muscle more flexible, to decrease the inflammation on your disc, to decrease the compression on your nerves, to increase the muscle relaxation, not to be tight. So I mean, we need a proper treatment, not only symptomatic treatment of the causes. We need the proper treatment, proper relief of the inflammation, of the pain, on the compressing of the nerve, of everything, not only symptomatic treatments. Before we start the treatment protocol, you should know that there are 5 main cases that you should consult your doctor immediately. 5 main cases. First one is problem in controlling your urination. If you have a problem in controlling your urination, you can't control it, you should consult your doctor immediately. Second one is severe muscle weakness in lower limbs, especially. If you have a severe muscle weakness due to back pain, you should consult your doctor immediately. Third one is severe numbness in your legs. Normal numbness, of course, it will happen because you have a back problem. But severe numbness that you can't handle it, it means you should consult your doctor immediately. The fourth one is fever. And the last one is unexplained weight loss without following a diet. So we have 5 cases. If this happened to you, you should consult your doctor immediately. The first one is problem in controlling your urination, then severe muscle weakness or severe numbness in legs, fever, or unexplained weight loss without following a diet. Types of back pain. You should know that there are 2 main types of back pain. The first one is the acute back pain. This type starts quickly and lasts for less than 6 weeks. It can be caused by sudden falling down or any traumatic cause. So the acute back pains happens quickly, not like the chronic one. Second one called the chronic. Chronic, it means it happens over the time, gradually, and it lasts for more than 3 months, not like the acute type. And it can be caused by degeneration or muscle tightness, muscle spasm, wrong daily habits that we will discuss later. Actually, most of us is we have this the chronic back pain. It means we are following like wrong habits in our posture, or not doing exercises, or we are not fit. That's why we are experiencing this chronic back pain. But the other one, the acute back pain, it happens with falling down or traumatic causes like accident or something.